Imagine this. You're at home, completely alone. Maybe you're watching television or reading or just finishing the dishes. It's an ordinary evening. Then, without warning, a feeling unlike any other strikes. A crushing, squeezing pressure in the center of your chest as if a weight is sitting on you. A sharp pain rockets down your left arm, making it go numb and heavy. Suddenly, you can't catch your breath. Each gasp is shallow, insufficient. The room might spin. A cold sweat breaks out on your skin. You are having a heart attack, and there is no one there to help. This is not a hypothetical fear. It is a terrifying reality for hundreds of thousands of people every single year. The isolation in that moment magnifies the terror. Panic, that primal response, begins to cloud the mind. But what if you knew that in that first critical minute, your actions could dramatically alter your fate? Groundbreaking research has revealed that knowing exactly what to do in the first 60 seconds of a cardiac event can increase survival chances by a staggering margin. The difference between life and death isn't just about luck or quick emergency response. It's about what you, alone in that room, do before you even pick up the phone. Yet, the same research exposes a heartbreaking gap in knowledge. A vast majority of people have no concrete plan for this precise scenario. They freeze, they panic, they waste precious seconds on unhelpful or even harmful actions. Today, we're going to change that. We are going to walk through, step by step, a series of scientifically supported techniques designed for one person alone: you. These are not folk remedies or internet myths. These are strategies backed by emergency medicine and cardiology, methods that buy the most valuable commodity in a heart attack: time. Let's begin before the event even happens, with your immediate environment. When every second counts, communication is your first lifeline, but during a heart attack, your brain is being deprived of oxygen. Confusion and disorientation can set in shockingly fast. Studies of survivors show that many could not recall their own address when calling for help. It's not a memory failure, it's a physiological reality. So your first line of defense is preparation. Write your full address, including any apartment number or specific entry instructions, on a bright card and tape it next to every phone in your home. Program emergency services into your phone's speed dial. This seems simple, but when fine motor skills and clear thinking vanish, hitting one button is infinitely easier than pressing 3 digits in sequence. Keep your cell phone charged and within arm's reach at all times, especially at night. Consider a medical alert device if you live alone, and this is crucial. Wear it constantly. Choose one that is waterproof and never take it off, not for sleeping, not for showering. The small discomfort is meaningless against the guarantee it provides. Finally, build a silent network. Inform a trusted neighbor about any heart concerns. Give them a spare key. Tell them to be alert for unusual sounds or a break in your daily routine. In an apartment, let building management know. These people aren't just neighbors. They are potential first responders who can grant paramedics immediate access, shaving vital minutes off the response time. Now, let's talk about a technique that is often misunderstood, but can be powerful in the specific window: controlled coughing, sometimes called cough CPR. This is not for when you are unconscious. It is for the very first moments of symptoms, when you feel the attack beginning, but are still alert. The theory is that forceful, deep coughing creates pressure changes in the chest that can help maintain some blood flow to the brain if the heart rhythm becomes erratic. It can, quite literally, buy you a handful of extra seconds of consciousness. Here is how it's done correctly. At the very first sign, take the deepest breath you can possibly manage, filling your lungs completely. Then cough, hard and deep from your diaphragm, as if trying to dislodge something from the very bottom of your chest. Repeat this cycle: a huge breath in, followed by a forceful cough, every 2 seconds. This rhythm can help maintain circulation just long enough for you to call for help or reach medication. Remember, this is a temporary measure, a bridge to the next action, never a replacement for calling emergency services. Its effectiveness is measured in seconds, but those seconds are everything. Next, we address the most well-known piece of advice: taking aspirin. But there is a right way and a wrong way, and the right way works up to 50% faster. During a heart attack, a blood clot is often the culprit. Aspirin works to thin your blood, to keep that clot from growing and to allow some blood to flow past the blockage. The key is speed. You must chew the aspirin. Do not swallow it whole. Chewing breaks down the coating and allows the medicine to be absorbed through the lining of your mouth, entering your bloodstream in roughly half the time. It will taste bitter and unpleasant. That taste is a sign it's working quickly. The standard dose is 325 milligrams. Keep uncoated aspirin in multiple, easy-to-reach places: by your bed, in your living room, in your car. Check the expiration dates regularly. If you are already on a daily low-dose aspirin regimen, you should still take the full 325 milligram dose during an event, as the preventive dose is not sufficient to tackle an acute clot. Of course, never take aspirin if you are allergic or on specific blood-thinning medications without a doctor's pre-approved plan. Your physical position is another tool you control. Instinct might tell you to lie down, but lying completely flat can sometimes make it harder for your heart to pump. Instead, if you are conscious and able, sit up. Prop yourself against a wall or pillows at about a 45-degree angle. Bend your knees. This semi-reclining position, called the semi-Fowler's position, uses gravity to ease the heart's workload, allows your lungs to expand more fully for better breathing, and can help prevent fluid backup. If you begin to feel faint, do not fight it. Carefully lower yourself to the floor. Once on the ground, roll onto your side into the recovery position. This keeps your airway open if you lose consciousness and prevents choking if you vomit, which is not uncommon. Immediately loosen any tight clothing, belts, collars, ties. Every constraint you remove makes it slightly easier for your strained cardiovascular system to function. Now, let's confront the panic directly through your breath. The body's terror response is to hyperventilate, quick, shallow gasps. This actually reduces oxygen efficiency and strains the heart further. You must override this instinct with deliberate, controlled breathing. The technique is called paced diaphragmatic breathing. Inhale slowly and deeply through your nose for a count of 4. Feel your belly expand, not just your chest. Hold that breath for a count of 4. Then, exhale slowly and completely through pursed lips for a count of 6. This extended exhale is critical. It activates your body's natural calming response, slowing your heart rate and reducing its demand for oxygen. This kind of breathing maximizes oxygen exchange, lowers blood pressure, and can prevent coronary arteries from spasming further. Practice this daily when you are calm. The goal is to make it automatic, so in crisis, your muscle memory takes over. If you are on the phone with a dispatcher, count out loud. It maintains your rhythm and tells them you are still conscious. One of the most tragic realities is a paramedic team, lights flashing, arriving at a home only to be stopped by a locked door while a life slips away inside. The moment you recognize symptoms, if you are physically able, your very first action, even before calling, should be to unlock your front door. Leave it slightly ajar. Strength and coordination can fade in minutes. Once on the floor, you will not be able to get up to unlock it. Consider installing a key lockbox outside and giving the code to your local fire department. When help is called, turn on all the lights in your house. At night, this makes your home a beacon. During the day, hang something brightly colored from your front window or door. If you live in an apartment, call emergency services, then immediately call your building's concierge or security to guide them up. Keep a whistle near you. If you become unable to speak, the sound can lead rescuers straight to you. Tape a simple medical information sheet inside your front door. Name, medications, allergies. Every one of these steps shaves off another minute of delay, and in this race, every minute is heart muscle saved. Finally, we come to the most potent tool you might have at your immediate disposal if you are at risk: nitroglycerin. For those with known heart disease or significant risk factors, having an emergency prescription can be life-altering. When used correctly in the first minutes of an attack, its survival benefit can mirror having a paramedic already in the room. Nitroglycerin works by rapidly dilating blood vessels, easing the heart's workload and improving blood flow. The protocol is specific. At the first sign of symptoms, sit down immediately. Do not stand. Place one tablet under your tongue and let it dissolve completely. You will likely feel a tingling or a headache. This means it's working. Wait 5 minutes. If symptoms persist, take a second tablet. Wait another 5 minutes. If they still persist, take a third tablet and call emergency services if you haven't already. Never take more than 3 and 15 minutes. Storage is critical. Keep it in its original dark glass bottle, away from heat and light, and replace it every 6 months as it loses potency. There is one vital warning. If you take medication for erectile dysfunction, you cannot take nitroglycerin within 24 to 48 hours. The combination can cause a fatal drop in blood pressure. Used in conjunction with chewed aspirin, these two medications provide a powerful 1-2 punch against the evolving heart attack, preserving muscle and stabilizing you until advanced help arrives. Knowledge is not just power in this scenario, it is preservation. It is the series of deliberate, calm actions taken in the face of utter terror that strings together the minutes needed for survival. These techniques are a ladder, each rung pulling you further from the edge. But this knowledge is useless if it remains a passive idea. You must practice the breathing now. You must check your aspirin supplies tonight. You must write your address on those cards and have that difficult conversation with a neighbor tomorrow. Your heart's rhythm is a profound mystery, but your response to its crisis does not have to be. Prepare while your mind is clear, so if that moment of crushing weight ever comes, your hands, your breath, and your will know exactly what to do. You are not just waiting for help, you are beginning your own rescue.